The youngest case of early pregnancy in the Philippines was recorded in the Philippine Statistics Authority. Two young girls aging 10 years old have delivered live births in the regions of NCR and Calabarzon. As a health practitioner, this is alarming concerning for both the health of the mother and the infant. Teenage pregnancy has also become one of the reasons teenagers do not complete education, increasing out-of-school youth and poverty. To prevent these consequences, early introduction and reiteration about contraception and birth spacing should be implemented, especially today that healthcare centers are at risk of COVID-19, frightening mothers to visit them. Early child rearing has numerous consequences. This may lead to problems in physical health, mental health, and social health. Not just the mother, but her baby and family will be affected. Teenage mothers had the worst overall fitness of any group of women surveyed, including those who practiced unprotected sex. That is according to Patel 2012. Pregnancy and childbirth complications and unsafe abortions are some of the leading causes of death for teenage mothers worldwide. Teenage mothers ages 10 to 19 years are more likely to experience preterm labor, eclampsia, puerperal endometritis, and systemic infections than women aged 20 to 24 years, and their babies are more likely to have low birth weight and serious neonatal conditions. That is according to WHO 2020. Carrying an infant and being a teenage mother affects more than just physical changes. Women go through emotional shifts as well. The stressors are most likely due to unintended pregnancy, the stigma attached to early pregnancy, inability to finish school, pressure from disappointed family and relatives, role shift, sleepless nights, unaware of childcare, and financial difficulties. There will be a lot of thoughts going through teenage mothers, which may lead to the breakdown of their mental health, leading to depression. Teenage parents usually don't finish high levels of education, and for that reason, they frequently have less employment opportunities, which leads to low socioeconomic income. Mothers and babies may not have access to healthy food because of this. In other words, poor income will have consequences to the nutrition, health, daily living, and other basic needs of the mother, the baby, and the family. Youth should value the importance of education and their privileges. Ensuring education helps end extreme poverty, hunger, and illnesses. Many colleges and universities today offer free tuition with quality education. Even basic education like reading, writing, listening, and speaking are possible. This will help gain better employment in the future, leading to the ability to provide needs to their families. These children most likely to face struggles throughout their lives. Many problems include providing less education and experiencing worse behavioral and physical health outcomes brought by poverty, maternal health, and this will likely to recur in their future family. The goal is to break this never-ending cycle for adolescent mothers, their children, and their children's children. Teenagers who already engage in sexual activities obviously have the tendency to get pregnant. If teenagers decided to have sex, it means they are ready to take the responsibility of whatever outcome. They could get pregnant one after another every year until their menopausal period. Imagine giving birth every year. Therefore, to prevent this, education and provision of contraception is necessary. Teenage parents should be aware of these consequences that will affect their physical, mental, and socio-economic life. Here are some lists of advice to consider for teenage parents. Value education. Listen to your parents. Keep away from bad influences. Practice a healthy lifestyle. Good looks are not enough. Teenage pregnancy is not encouraged. Abortion is not the answer. Use contraception. Practice birth spacing. Seek medical help. Keep updated on your community center. Prepare for the future. Educate your future children. Love yourself. Redeem yourself. Adolescents who wish to prevent pregnancy may be unable to do so due to knowledge deficiencies, myths and beliefs, difficult access, and misused contraceptive measures. To help the patients make their choice, healthcare providers should perform and reiterate the following. Ensure the necessary skills and knowledge to provide unprejudiced, non-judgmental, evidence-based, adolescent-friendly sexual health and reproductive health care. Assure confidentiality and the awareness of the need to be breached. Assess awareness, knowledge, capability, and needs. Provide available natural and artificial contraceptive options for the mothers, fathers, or the couple together. Counsel regarding the methods, its cost, efficacy, adverse effects, and risk. Involve family, parents, and the partner in this regimen. Provide all information as needed, including the changes, availability of new resources and services in the community. Home care follow-up and provision of contraception. Offer annual check-up and follow-up. Being a teenage parent is hard and still highly discouraged. However, they should never be demonized. What's done is done. This is going to be difficult. Nevertheless, learn to stand up from what you have done and do well in life.